The disproportionate impact of Alzheimer's disease on women is a disturbing reality that continues to elude simple explanations. While the longer life expectancy of women has often been cited as a contributing factor, emerging research suggests that biological, hormonal, and even social factors may play an even greater role. The latest studies reveal that women are not just more likely to develop Alzheimer's, but may also experience a more aggressive progression of the disease. These findings paint an unsettling picture of a condition that is far more complex than previously understood, and one that disproportionately threatens the cognitive health of women worldwide. One of the most alarming discoveries relates to the buildup of toxic proteins in the brain. Researchers from Massachusetts General Hospital and Harvard Medical School have found that women accumulate tau proteins, one of the primary drivers of Alzheimer's, at a faster rate than men. These harmful proteins interfere with neural communication and lead to the widespread brain damage characteristic of Alzheimer's disease. The study suggests that hormonal changes during menopause could be a key factor in this process. Estradiol, a hormone that provides neuroprotective benefits, declines significantly during menopause, leaving the brain more vulnerable to degenerative changes. This hormonal shift, coupled with an increased risk of cardiovascular disease post-menopause, creates a dangerous combination that accelerates cognitive decline. Even more troubling is the potential link between stress, depression, and Alzheimer's risk. Women are statistically more likely to suffer from chronic stress and mood disorders, conditions that have been shown to contribute to the accumulation of both tau and amyloid proteins in the brain. Psychological distress triggers biochemical changes that can lead to increased inflammation and neurodegeneration. This means that negative thinking patterns, anxiety, and untreated depression may not just impact mental health, but could actively accelerate the onset of Alzheimer's in women. Despite these grim findings, the healthcare system remains woefully unprepared to address the gender disparities in Alzheimer's research and treatment. Many diagnostic and therapeutic approaches are still based on studies that do not account for sex-specific differences in disease progression. The assumption that Alzheimer's affects men and women in the same way has led to delayed diagnoses and suboptimal treatment strategies for female patients. For instance, while hormone replacement therapy, HRT, has shown promise in reducing Alzheimer's risk, there remains no clear consensus on how and when it should be administered to maximize its protective effects. This lack of targeted intervention means that countless women continue to face an elevated risk without adequate medical guidance or preventive care. Adding to the crisis is the socioeconomic burden that disproportionately affects women. Many women, particularly in older age groups, have limited access to healthcare resources due to financial constraints or caregiving responsibilities. This prevents early detection and intervention, further exacerbating their vulnerability to the disease. The combination of biological, psychological, and social factors creates a perfect storm that places women at a uniquely high risk of Alzheimer's, yet little has been done to address these disparities on a systemic level. The growing body of evidence makes one thing painfully clear: Alzheimer's is not just a disease of aging but a pressing gender health crisis that demands immediate attention. Without urgent action, millions of women will continue to suffer the devastating effects of a condition that could have been mitigated with better research, early intervention, and tailored treatment approaches. The time to act is now, before another generation of women is lost to this relentless and unforgiving disease.